Welcome back. Today we are digging into a major development in healthcare data security with new insights straight from the HHS and NIST Security Conference. There's a lot of pressure mounting on healthcare organizations to step up their security measures. If you work with health data or handle any sensitive information really, this episode's going to give you a rundown of what's coming and what you should be doing right now. Now, why the big push? Well, there's a lot at stake. Healthcare data includes everything from patient medical records to personal details that, in the wrong hands, could cause real harm. But it's not just about privacy, it's about patient trust. When people feel that their information is safe, they are more likely to trust and return to their providers. And then there's the reality that healthcare organizations with their vast networks and data stores are prime targets for cyber attacks. The HHS and NIST conference zeroed in on areas healthcare organizations must focus on to protect this data and meet the tightening compliance requirements. In other words, we are talking about proactive security, not just putting out fires. First, let's talk security risk analyses. If you think of an SRA as a quick checkoff for compliance, it's time to reconsider that. The conference emphasized that SRAs should be dynamic and ongoing. Imagine it as a regular checkup for your cybersecurity. It's not something you do once a year and then forget. It's a core part of a living cybersecurity strategy. SRAs help to expose hidden vulnerabilities across systems, networks, and even third-party vendors. The more in-depth your analysis, the stronger your defenses. With the OCR making it clear that they are watching closely, organizations should prioritize thorough and frequent SRAs to avoid surprises. Now let's talk about OCR, the Office for Civil Rights, for a sec. They're the main enforcers of HIPAA compliance, and their recent focus has been sharp and unapologetic. At the conference, OCR laid out their expectations: proactive identification of vulnerabilities, solid employee training, and real demonstrated commitment to data security. It's not just these big organizations either. The OCR is cracking down across the board, from large hospital networks to smaller clinics. The message was clear. It's not enough to be reacting to issues as they come. OCR wants proof that healthcare providers are staying proactive, keeping their practices and protocols up to date, and continuously monitoring for risks. Incident response plans were a big topic as well. With today's threat landscape, every healthcare organization should have a clear, rehearsed plan for managing breaches. Think of it as your emergency blueprint. Who is notified first? How quickly do you inform the patients? How do you communicate what happened transparently? Regular drills of these plans are a must. Practicing these response plans ensures that if an attack happens, you can respond swiftly and protect patient trust. Because in a breach, time and clarity matter more than anything. The conference also dove into the types of threats that we're seeing today, and the picture was intense. Ransomware continues to pose a severe risk, with hospitals and healthcare systems being major targets. Imagine an entire hospital's data locked up until a ransom is paid. The solution: ramping up endpoint security, network monitoring, and making sure your backups are recent and reliable. And of course, phishing attacks are only getting more sophisticated. Organizations should train their employees regularly on how to spot red flags, because one click could cause a breach. If there's one thing that the conference made clear, it's that security isn't just the IT department's job. Creating our security-first culture means every team member, from the top executives to the frontline staff, plays a role. Frequent, engaging training can make the difference. Small habits like recognizing a suspicious email or practicing good password hygiene are all part of building that security environment. So what's next? Well, more regulations are likely on the way. OCR and NIST are already discussing tighter guidelines for encryption, response times, and vendor oversight. Healthcare providers now need flexible, evolving policies to keep up with the threat landscape. All right, let's close with a few steps that you can take today. Number 1, treat your security risk analysis as an ongoing priority, not just a formality. Number 2, keep up with OCR guidelines. They are evolving quickly right now. Number 3, make sure your incident response plan is rehearsed and ready. Number 4, invest in regular staff training to build a security-aware team. And number 5, prepare for new guidelines. Staying agile will help you to stay compliant. Now that's all for today's episode. Cybersecurity is all about protecting not just data, but the trust that patients place in healthcare. Thank you for listening, and if you found this helpful, share it with someone who would benefit from a cybersecurity refresh. All right, see you next time.